ever tried to help your parents with their Medicare insurance or prescription drug planning, you know how complicated and frustrating that conversation can be. And a lot of times, you're kind of thrown into the position of helping people and you have no idea where to start. And I know this is not fun. Handling your parents' Medicare insurance is not something that you want to take on in your already busy life. But please trust me, this is so important. It's something to handle, something to understand before there's a problem with your parents' health. My name is Stephanie Pogue. I'm a certified Medicare insurance planner, and you are listening to Aging, Healthcare, and Everything in Between. When you're thrown into a position like this, the first thing that you need to know is what your parents actually have, or if you're trying to help any elderly loved one. Medicare is not like regular group insurance, regular employer group insurance that we're all used to. It's very different. So first you have to figure out what they have, what kind of coverage they have, what's going to happen when they go to the doctor or the hospital, and then you can determine if the plan that they have is right for them. So your very, very first step, you need to find their Medicare card. Medicare is something that they get. Everybody qualifies for it when you turn 65, but not everybody takes it right away. Some people wait until they retire. But if your parents are over 65 and retired, they have Medicare, and you need that Medicare number in order to really help them get started. Their Medicare card, we treat it sort of like a Social Security number. You don't want to give out the Medicare number to just anybody. So they may be carrying it around in their wallet or their purse, but most likely you're going to find their Medicare card somewhere else in some kind of safe deposit box or a folder of important information. That's where you want to look for this. It's just a white card. It has blue on the top, red on the bottom, and it has a set of digits. It's numbers and letters. What you will also find on that card, it says Part A and Part B, and there will be a date next to it. Those dates are when they got their original Medicare. Now, you may be wondering what Part A and Part B is, and there's a lot of information online that you can find out about that. But basically, the summary is Part A is going to cover anything in the hospital. It's original Medicare. It doesn't cost any monthly premium, but it also doesn't cover everything in the hospital. They have deductibles and things like that. And then Part B covers doctor's appointments and then everything out of the hospital. Now, your parents are paying for Part B. They may not know it because it comes right out of their Social Security check before it's even deposited into their account. But there is a charge for Part B. Now, if they only have original Medicare, they're going to end up with huge deductibles. They could end up with 20% of everything outpatient. So what most people do is get something to go along with that Medicare. That's where we'll go next. If for some reason you cannot find that Medicare card, and this happens a lot, especially if your parents are in their 80s or 90s and they've had it for a long time, there are a couple of ways that you can get it. You can call 1-800-MEDICARE. Usually the beneficiary does have to be on the line with you. You can order a duplicate ID card. They will not give you the Medicare number over the phone, but they'll send another ID card. Or you can go to Medicare.gov and set up a My Medicare.gov account for them. On that Medicare.gov account, you can order duplicate ID cards. You can see all their claims. It's a wealth of knowledge and information if you set up an online portal. It's just like setting up your own insurance portal, but it's with Medicare. Now, once you have that number, you need to know what's going along with the Medicare. Most people don't have original Medicare only. They have something, it's either called a Medicare Advantage plan or a supplement or Medigap plan that goes with it. They are two very different things, and you can't have both. The easiest way for me to figure out when someone comes into my office and says, I have no idea what I have, the easiest way to figure it out is to pull out your ID cards. When you find their card and you're asking them specifically, what do you take to the doctor? What card do you take to the hospital if you have to go? What do you take to the pharmacy? Those are the ID cards that you're looking for. And then on that card, there's a couple of different things you want to see. If it says HMO, PPO, if it has different copay amounts for doctors, emergency room, if it has a copay for prescriptions, that is most likely a Medicare Advantage plan. If the card, on the other hand, says it just has a member ID number and it says Plan G or Plan F or Plan N, that is a Medicare supplement. Also, don't get confused. Parts A and B of Medicare, those are original parts of Medicare. Plan G, F, or N is a Medicare supplement plan. Two completely different things. I know it's a lot of information, but you need to know it as you go through. The other thing that happens a lot is people will pull out several ID cards. They keep the cards year after year after year, and it's hard to know which one's the most up to date. Medicare supplement cards don't change that often, but Advantage plans do. People will get a new card every single year. And if you look really closely, there will be a printed date. That's what you want to look at. Keep the most recent card, and now you know what type of coverage they have. Your next question probably is, what's the difference? Why would I have an Advantage plan or a supplement? Like, what does she really have here? What does my mom really have here? So there's a couple of differences. With the Advantage plan, they're probably not paying any additional monthly premium or a very low amount. But instead, there's going to be copays. Every time they go to a specialist, the emergency room, they have surgery, anything like that, they're going to pay copays. With these Advantage plans, what you need to watch out for is that there's usually a network of doctors that they have to stay in. So if you're trying to schedule your parent a physical therapy appointment, or they need rehab for some reason, you need to make sure that those providers, hospitals, everybody is in the network if they're on an Advantage plan. You also want to watch out for referrals. Some plans require referrals. So if they do need a physical therapy appointment, they have to get a referral from their primary care doctor to go see someone. So don't forget that step. People like Advantage plans and usually enroll in them because they all of the extra benefits. So these also include dental coverage. There's some allowances for eyeglasses. There are huge discounts for hearing aids. Sometimes it will provide transportation to and from doctors if you can't be there. And don't forget to really look closely at the extra benefits, because sometimes it includes groceries or things to buy, amounts to buy things over the counter, like cough medicine and ibuprofen and that sort of thing. So really look into, once you know that they have an Advantage plan, really look into the extra benefits that they have. Also, prescriptions are included in this plan. They're still going to have copays, but it's all lumped into one program. Now, if they have a Medicare supplement, it works differently. With this, they're going to pay an extra monthly premium in addition to whatever they're paying for Part B out of their Social Security check. So this premium, if you see something on their checking account from a health insurance company, they most likely have a Medicare supplement. But now, since they're paying that monthly premium, they may have a very small deductible, and then they have no other medical bills after that. Every medical bill is going to be covered by either Medicare or the supplement. So that's what they're paying monthly for, is that coverage. You don't have to worry about referrals on this plan. You don't have to worry about networks of doctors. They can go anywhere that they want to go that accepts Medicare. What you do have to watch out for, though, is these supplements only cover medical. So there is no dental coverage. There are no eyeglass allowances, and their prescriptions are a completely separate plan. So if they have a supplement, you're also looking for a Part D prescription plan ID card. It will say RX somewhere on it, and this is what they're taking to the pharmacy to get their prescriptions. Again, it's separate from their supplement. It might be a whole different company, but they need one of those as well. Now, that's the hard part. That's where you start. Find their Medicare card, their Medicare number, find their insurance card so you know if they have an Advantage plan or a supplement, and you'll also know what company they have their insurance with. That's the hardest part. Now you can start figuring out what benefits are covered and see if something else is better. One last incredibly important thing, though. Medicare itself is designed to get you healthy and get you back to life, back to your normal life. It is not designed to care for us as we age, to care for our aging bodies. So it's a common misconception that Medicare and the insurance plan will pay for extended care, or long-term care, or rehab, a lot of rehab, and it does not. Even though Medicare, you might read that it covers 100 days of skilled nursing or rehab, that's maximum. Usually, in practice, most of the time, all it's covered is about 20 days. And I see this all the time. People fall, they break an ankle or a hip, and they're in the hospital for a while. And then they end up with pneumonia because they're just in the hospital bed. And then they make it through their rehab, and they're sent home. Well, they're very weak because they've been in the hospital for a long time. They really can't take care of themselves. But because they're not getting any better, Medicare is not going to pay for the extended rehab or the extended care. So they're sent home. And if you choose to get a home health care agency or someone to help out with, moving them around, or the cooking and the cleaning and, just being there with them while they're healing and getting better, that all comes out of your pocket or your parents' pocket. That comes out of their income, their investments. Medicare is not going to pay for that. That is definitely something that you want to plan for and prepare for while they're still healthy. I know a lot of times you're thrown into this when there's a problem, but if you have the luxury of just being able to take care of your parents while they're still healthy and just being involved from the side, please do that. Please figure out what Medicare plan they have, figure out if that's the best plan for them, and talk to them about their long-term care and extended care needs and see if they have something in place. If they don't, you want to look into it. You want to get something in place because rehab is expensive. Long-term care is expensive. And again, Medicare isn't going to cover that. I really suggest working with a health insurance broker who specializes in retirement, Medicare, and long-term care, like I do. We have a wealth of knowledge, and we can explain all the benefits for you in detail for you and your loved one. Definitely have the conversation with everybody all together so everyone's on the same page. And there is no fee for our services. So find a reputable broker, sit down with them, figure out what your parents have now, and then make a plan for any kind of long-term care. I hope you enjoyed this and you found it helpful. I look forward to our next episode.
Thanks for listening to another edition of the Aging, Healthcare, and Everything in Between podcast. Please share this podcast so that others can benefit from the content. Please also leave reviews, as feedback is important to me. And if you have any suggestions for a future episode, email them to s.pogue@stlouisinsurancegroup.com. Thanks again for listening, and I look forward to bringing you more valuable content soon.